so that we're going to have this for everybody. And here we go. I want to warn you, I have my grandkids trying to beat y'all. So let's see how you do. They're 9 and 11, so they're kids. So maybe they know kid stuff, right? PIN number 415449. Remember, as we're going over this and you're not understanding something, please just stop me and let me know and let me explain it to you, because I know if it's not you, it's somebody else. See, look, there's a grandchild right there. Oops.
How do I get on?
You put that number in, Max, 415449. Oh, we have a Florence Nightingale.
Not mine.
Oh. And you enter it.
None.
All right. It's okay. We're going to get going. I got to get started. You might need to help them, honey, okay? All right. This is a 59 question review. It's going to lead us right to where we need to be today. So, and it's a good one and it covers the concept. So a toddler swallows grandma's digoxin. What should you anticipate? Well, what do we know about digoxin? And if they're swallowing a lot of digoxin, I mean, what is going to be your biggest concern? I mean, we know signs and symptoms. We know what we're looking for. We know infants, it may just be that vomiting, but you're going to have that digibind, the digoxin immunoflab ready, because we need to bind it and we need to get rid of it because it can cause a lot of damages and slow down that heart rate really too much. So a multi. Signs of respiratory distress in children. What do you see? Now, remember, in the infants is where you see a lot of these sort of respiratory distress. Late respiratory distress is bradycardia. Early distress is tachycardia. The heart's trying to beat faster, but they're getting restless, hypoxic, grunting, that little at the end of those respirations. And the little infants are going to have those little flaring nostrils. And if they're older flaring, you're in trouble. When a pediatric patient has an amputation, what priority teaching is very important? And then I'll say, does it matter if it's a child or an adult, right? And our goal for anyone with an amputation is try to keep them mobile, right? To keep them their activity is well what it was before. So make sure there's no breakdown. We want to put a prosthesis on there, preventing infection. A multi. What is acute myeloid leukemia in children and what are the symptoms? So ALL, leukemia. So this is everything. You know, remember leukemia is also going to go and with the chemo attack the hemoglobin hematocrit, so the red blood cells. And some of the beginning symptoms are that joint bone pain, fevers, which is that infection, and then bruising. And then they'll go in, look at that CBC, that white blood cells, see what's going on, and then the diagnosis is made. Remember, AML is less frequent and harder to treat than ALL. A multi-select. What are the signs and symptoms of pyloric stenosis? Pyloric stenosis is your infants. It's going to be 3 weeks to about 3 months. And this is where we ask those parents, so tell me, what does that vomiting look like? Is it a dribble or is it across the room? And if they're saying it's projectile, put your hand up, feel underneath that xiphoid process, and you're going to feel that hypertrophic pyloric sphincter on the stomach, and you can feel it. It does feel like a little olive or a marble is what I call it. Another multi. What may be a problem seen after surgery for tetralogy of Fallot?
No.
So remember, tetralogy of Fallot is that one diagnosis you're going to see, and it's going to be on your NCLEX, guaranteed. So that's why I cover it pretty good. Now, all of a sudden, you're going to see them tired. And when you see them tired, breathing harder, they're not eating well, the next thing I'm going to listen for is let me look at those breath sounds. And usually, because their heart already has congenital defect, you might see it go into congestive heart failure. And that's a common side effect of congenital heart surgery, any of them. Another multi. What are defects associated with tetralogy of Fallot? Remember, tetralogy is the pulmonary artery, okay? And that pulmonary artery, something covers it, and it doesn't allow blood to flow. All right side, except for that overriding aorta, they call it. So pulmonary tract obstruction, there is a hole between the chambers which allows some blood flow and decreases the pressure of that right ventricle. And then that right ventricle, because it's extra flow, can't go up, it stretches that ventricle. And that's what hypertrophy means. And the aortic stenosis is left side, has nothing to do with tetralogy. What would cause an infant to have nasal flaring? When you're talking nasal flaring and then you talk a grunt behind it, as I've said before, be prepared. That infant, that younger child is about ready to crump on you. Have your code cart ready and be prepared. They are in severe respiratory distress when it gets there. An 18-year-old parent wants the lab results of their child. What do you tell them? Remember HIPAA, and as long as an 18-year-old is cognitively aware and alert, they sign for their own treatment at age 18. So you have to ask that child. Parents don't like it, and you're going to see some resistance, but you cannot unless the child says okay. And most of the time, the parents say, you better tell them to give me permission. Again, they're coerced to do that, but they did give permission. What is Synagist and why is it given? And it's usually monthly. It is from late fall to early spring. We use it in immunosuppressed or premature infants, and usually the first year of life. And it prevents RSV, because give a child who already has some issues and put some mucus in their airway, they can't breathe. So the RSV prevents that mucus and again allows them to eat what they need to. And of course, you need nutrition. What is the highest priority with a preoperative infant with bladder exstrophy? Highest priority. So bladder exstrophy, what is it? The bladder is born on the outside. It's like a midline closure, they call it. So the bladder is outside, and we need to, number one, get some normal saline, sterile dressing, cover it, worry about the integrity of the skin, and also prevent infection. Now, do we monitor urine output too? Yes, but the infection is priority on this one. A 10-year-old wants an insulin pump for type 1 diabetes. Is this something we should do? This is a pump, and we put a little subcutaneous needle into the skin and put a dressing on it. And it can stay there, I've heard, up to 7 days from people who are type 1 diabetes. So if a 10-year-old is alert, oriented, has the ability to problem solve that pump, understand checking the blood sugars, giving boluses, absolutely, it's great. It means one shot in 10 days, 7 days, as long as it's supposed to be in there before they change it. So it's a great option for them. I've
Professor,
seen a lot of young kids give it. Yes.
are they able to play sports with that? No, correct? Because it might
Oh,
rip out.
absolutely.
They
Absolutely.
can.
Any
Oh,
diabetic can, as long as, and this is the key with that. This is a great question. Before they go play sports, they need to check their blood sugar. And if it's a little bit lower, they need to take something to eat before they play the sports. And then make sure they keep hydrated during the sports. And if it
okay. I
lasts
thought it
too
would rip
long,
out.
oh no, absolutely. You want to keep these kids normal. We want
Huh.
them to do everything that they're supposed to do, but we have to keep that blood sugar okay. Now, playing football with a pump, that's one thing. I think you would
Okay.
have to choose your sports. A multi. When and how would a Lyme test be done on a child? What's the Lyme test all about? So we want to check because these kids could have been out in the fields and maybe we saw a tick bite, and we want to make sure they didn't get Lyme test. So it detects that Borrelia, that name there, which can really get these kids really sick. And we do it usually after we see those big type of rashes, the bluish rashes that come with it. And it's usually 1 to 2 weeks after they're exposed. What might you see after administering a bolus of albumin to a child? What is albumin? We use this a lot when you talk about children with nephrotic syndrome. They don't have enough protein in their blood, and all the tissue fluid goes interstitially into the tissue. And you want to suck it out back into the intravascular space, and then we usually give Lasix after. And the goal, we want to increase urine output. We want to get rid of that edema. A multi. What is another term for erythema infectiosum? This is a common kids disease. There's been questions on the HESI regarding this. It's something that we don't really cover. It's one of your chapters in the book, but I do mention it in the cahoots here. So it's also called fifth disease. And also, their cheeks are red. It's like somebody had slapped them in their cheeks, and it's viral. And sometimes they get these big round rashes that are itchy like crazy. So one kid who went crazy itching required Benadryl and prednisone and all sorts of things because the itch was going that bad. But it's called fifth disease or slapped face, and it's viral. What is a treatment for pertussis? This is why we ask if children are immunized when we try to do room placement for children with upper respiratories, especially the younger children, because it's respiratory and it could be pertussis. And we give an antibiotic, Ciframax, and it's what's given. And if we suspect pertussis, these children are in respiratory isolation, those reverse flow rooms where the air from it doesn't come back in the hospital. It gets filtered outside. How do you get rid of cradle cap on an infant? So this is when the baby's born with that white scaly stuff on their head. And you know, parents want to put little girls, little bows, and with this white scaly stuff, they get upset. Just put mineral oil, you can moisten it, wash with soap and water and a soft, fine tooth comb. All of those things are okay to use that. And it does, it's not going to get rid of it first time. Might take a couple times. Postoperatively, abdominal surgery, child has an elevated heart rate and respiratory rate. What assessment might you make from that? The kid just had surgery, has elevated heart rate and an elevated respiratory rate. What does that mean? You know, and sometimes these children are paralyzed and sedated, and still you'll see that. And it all means this child is in pain. And that sometimes the only thing you'll see, because they can't move, they can't tell you, but that elevated heart rate, respiratory rate is telling you, and blood pressure up too, is going to tell you they're in pain. Let's give them a little bit more medicine. What can cause rheumatic fever? So rheumatic fever, all of them, the symptoms, the rash and the nodules and the big swollen joints, and the chorea, even that gait that gets a little bit shaky and wobbly and the frequent falling, all can be reversed with antibiotics. But heart valve damage never is repaired with the antibiotic. That's going to need a surgical or medical treatment, okay? So getting these kids in as soon as we see these symptoms and treating them with antibiotics is what they need. An adolescent girl wants information regarding birth control. What does a nurse do? You know, we've talked about adolescents and we've talked about how to talk to them. And, you know, we need to say, okay, abstinence is always the best, but they want information. So you give them information and you give them maybe a pamphlet or something about it, and then they can make their decision what to do. We can't put our biases in there at all. They're going to do what they want anyway. A multi. How can you control GERD in an infant? Gastroesophageal reflux. You know, that's with that little spit up. That's that question you ask. Well, your infant's vomiting. Is it just dribbling or is it across the room? So across the room would be, you know, your pyloric stenosis. And we're talking GERD. What we need to do is to make sure that they're burped. Make sure that they keep their head elevated for 30 minutes. And the other thing is thicken that cereal. And we thicken it with just 5 mLs of cereal in an ounce. And it's now they're not going to get nutrition from it, but they're saving all their milk. They're not spitting it up. So you'll see the rice cereal most likely in their stool because their GI tract's immature, but it does keep that cereal down. What is synergist? So again, this is given for those children to prevent RSV. Again, remember it is on those immunosuppressed children or premature that we want their respiratory, not to overwork it by getting that upper respiratory. A multi. A 50-month-old brings a spoon upside down to their mouth. And the mother says, is this normal? So 15 months old are just really starting to eat by themselves, right? So number one, why is she worried? Why is it wrong? At least they're trying to get the spoon to their mouth, right? It's normal. And they're experimenting. This is something new. They're actually playing with it. And all of that stuff is okay. Another multi. How is juvenile idiopathic arthritis treated? So when you're flaring, they'll give you steroids, but they're not going to continue it on all the time. NSAIDs are the pain medicine of choice, anti-inflammatory. Methotrexate is the other one that we give. And then they'll go into the biologics like the Humira, the Enbrel, infusions, etc. But steroids, they shouldn't be on for a long time, only as a Band-Aid. A toddler is vomited 2 times, is listless and irritable. What do you tell the mother on the phone? She's called you, says, what do I do? Well, remember, dehydration is very scary, right? And if they're vomiting and they're listless and irritable, that means they are already really down and they may not be able to tolerate PO. That child must be brought to the ER, most likely get an IV and IV bolus quickly. That listless, irritable is now dangerous. And we know dehydration is extremely dangerous in children, organ failure. An adolescent status post amputation osteosarcoma is angry and blaming the parents. Why are they doing that? You know, a lot of times these osteosarcomas are your teenagers, these adolescents. Remember body image, right? And then they lose their leg. You know, it's normal. They've lost a leg. Now their lives have changed and now they're trying to cope with this sort of things. So that is the answer. Good job, guys. A multi. What should the nurse assess with children with hypo and hyperpituitarism? Well, what does hypo and hyperpituitarism, what hormone does it secrete? And what do you worry about here? You know, I've said this all through the class. Every time they go to a doctor's visit, they always get a height and a weight. And it does, it evaluates, are they growing? Are they getting proper nutrition, right? So that's why we do it. That's one of the reasons. It's also the thyroid hormone too, right? Because thyroid works with the growth. So it's something that would be looked at if they're not where they should be. But just remember, if they're really short, that may be because of the family. So ask them, so is your family short or tall? Or look at the mother and father, are they short or tall? If they're short, maybe that's where they're supposed to be. A multi. An infant with a TE fistula, what should the nurse have at bedside? Do you have an opening between the trachea and the esophagus, a tube? This is that one where these children need to be without eat or drink, okay? Because anything that goes down can come up and aspirate, and you're worried about aspiration pneumonia. So you want the suction equipment there, the head of the bed elevated, and remember to give this child the pacifier, right? Because this kid is not going to get oral satisfaction. And how do infants self-soothe? Pacifier. They decrease their stress with it. A child's been having diarrhea for 3 days. What should the nurse check? Well, what happens when you have diarrhea?
You poop. Oh, you have bowel movements. Let me correct that. Bowel movements. Lots of bowel movements.
I love it. I love it. Absolutely. But you're losing fluid, right?
Yes.
So you're
Pedialyte.
always, again, worried about dehydration. So pulse rate, blood pressure for sure. And yes, the treatment is Pedialyte, Powerade, Gatorade. You made me laugh. Thank you. A multi. What is a VP shunt used for? A ventricular peritoneal shunt. So when you have a ventricular peritoneal shunt, it goes from the fourth ventricle in the brain, behind the ear, down the front of them into the peritoneum. And there's like a bulb here. Never, 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 never touch it. It's only for the neurosurgeon. We're, as a nurse, will be assessing their abdominal girth and their head circumferences every shift to make sure the head's not too big, the abdomen's not too big, and it relieves that pressure. Now, I ask you, if that VP shunt stops working in an older child, what would that child complain of? Fluids recollecting, right? So headaches and vomiting is what the signs and symptoms you would see. And usually they'll go and do a CAT scan, look at the shunt, see what it looks like, and then most likely go for surgery to either replace or to fix that shunt. And we know it works because the headache and the vomiting go away, right? Because the pressure is gone from the head. What would you see with a child with autism? ASD. The one thing that's classic is those repetitive behaviors. I've mentioned my little kid he was actually 8 Downs autistic child, where he'd take something and put it on a chair, put something on top and something on top. He'd take the top off, the bottom off, and he would go back and forth 10 times, 20 times. And it just gave him comfort, that repetition of different sort of movements, and of course, by themselves. A multi. A mother of a child diagnosed with Duchenne muscular dystrophy wants more children. What are you going to tell her? Well, what do you know about Duchenne muscular dystrophy? So we know that Duchenne muscular dystrophy is a recessive X-link of mother. So mother carries that genetic thing, and you're not going to know until they're about 3 years old if this child has Duchenne muscular dystrophy. Remember, this is a degenerative muscular disease. And by usually adolescence, the muscle of the heart stops or the diaphragm stops. And they usually die as teenagers. So it's a really serious thing to consider. Do I want more children, knowing the possibilities of passing it on? So genetic testing absolutely would be done, and we know it comes from mom. A multi. An umbilical hernia has become hard and painful. What should you tell the parent to do? When the babies are small and they have umbilical hernias, I've told you, I love them. They're soft, they squeegee, and they go in and out, right? And that's the intestines that's there. If that gets hard, it's probably twisted, and now blood supply has gone, and now it's a medical emergency. So if we tell that parent to make them NPO, you've speeded up the process to get them to surgery to save that intestines. And of course, go to the ER so that we can get them to surgery.
So I have a question.
Hold on a second. when should solid foods be introduced to an infant? So we know that iron fortified formula or breast milk for the first 6 months, and then we'll introduce them 4 to 7 days in between each food. Yes, what was the question?
With the umbilical hernias, so I remember like grandparents, they would say put a quarter around it. So does that not work? Because you said it was an intestine. So that doesn't work? Okay.
No, I've heard that before, and I've seen it before on children, because what happened is the peritoneum doesn't cover it, doesn't hold it in. The quarter is just acting like what the peritoneum cavity holding it in should be, but no, it doesn't work. I like that one. What acid-base imbalance is caused by hyperventilating? Well, if you are hyperventilating, you're blowing off acid, right? So you're left with what? Alkalosis. There's going to be 4 acid-based questions on your HESI. Usually that's what I see. So please go and review your acid base. A multi. A child's fallen and a stick has scratched their eye. What should you tell them to do? So remember, eye injuries, if it's floating around, you can take a tissue and get it out. If it's sticking in there, leave it alone. And if they just put that Fox shield, and they're saying now both eyes, put them on, so it's not making one eye move more than the other. And then either to get to the pediatric ophthalmologist or to the ER, we're trying to save the eye, especially if stuff is stuck into those eyes. An infant's congested febrile capillary refill less than 2, what should the nurse do? Interesting question, isn't it? So you're admitting this kid, what are you going to do? Well, you know that they're febrile and they've got an upper respiratory, but you don't know why. And you don't know, this question doesn't even talk about immunizations up to date. Again, this one you'd keep isolated till you know all of those answers, or till you determine what it is, if it's a viral or is it influenza, etc. A school-age child has reoccurring dermatitis. What suggestions would a school nurse provide the parents? Remember, dermatitis, eczema, they can scratch. It can become to the point of oozy and juicy and, irritating to these children. And then there's concerns regarding that, right? So what would you do? Now, during those times where you see it oozy and juicy, these children should stay home. Why? You're really protecting them from infection, right? Because all those kids, all those germs could get into it, and then it creates more of a big problem. So they should stay home. All the other ones, hypoallergenic, do we know that works? Homeschooling would be great, but all parents can't do that. And cotton gloves, actually, at nighttime, they should wear it so they don't itch themselves, right? But the school nurse should tell them to keep them home. A multi. Why do you give aspirin to a child with Kawasaki? Aspirin, and what do we give Kawasaki? IVIG, right? And why is the aspirin? Well, we know it's a vascularitis, an inflammation of the vessels, but it also can causes these, aneurysms, usually in the coronary arteries. So it prevents clots, it's anti-inflammatory, it's an NSAID, and it thins the blood. so the blood moves a lot quicker. It really does not affect pain. There is no pain with this disease. It's fever. Newborn child has suspected congestive heart failure. How would you know that? Newborn. Well, what is the normal vital signs in a newborn? Heart rate 140 to 160. It's not that. They can come out and usually their hands and feet are cyanotic, if you remember that. And cracked skin could be a part of it. But this, breathing fast and then it's central cyanosis when they cry. That is what it is. Because those hands and feet, that is not a telltale sign for a newborn. How do you medically close a patent ductus arteriosus, PDA? How do you close that? So PDAs, we keep them open with prostaglandins when we need it for oxygenation or cardiac output, and we close it when it's open and we don't need it. Now, I ask you, these patent ductus arteriosus, you hear a loud washer machine murmur. When you give indomethacin, it's a medicine, and we give it usually in 3 doses. When we give it, we can hear that murmur closing, then we know it's worked. And that's one of the questions that's always out there. Indomethacin, the murmur goes away. That's how you know it's working. A child post tonsillectomy is swallowing every 2 minutes. Why? What are you going to do? And this is something we would teach our parents on discharge, wouldn't we? I've told you all, I've seen a child start vomiting huge clots of blood post tonsillectomy 7 days after surgery. And this child went hemovolemic, required boluses of fluid, and had to be rushed to the OR and have it recauterized. So what do? Open their mouth, look at it. You're not going to stick any tongue depressors or anything, but you're going to look and you could see the blood in their mouth. And we're going to, at that point, of course, call the ENT, get them there, start your IV, get them ready for surgery because they're going to need recauterizing of that area. A child is walking on their tippy toes all the time. Now, my daughter had a friend whose daughter was doing this, walking on the tippy toes, and this is right at COVID, right at the beginning, and she was 2 years old. And I said, she needs to go to neurology, and she really needs to be evaluated. And they did determine that she did have a form of autism because the brain wasn't working the way it should. And that was the telltale sign, walking on their tippy toes. Interesting, huh? Multi. What treatment should a child in pain with juvenile idiopathic arthritis have? So JIA, it's NSAIDs, as I said, it's anti-inflammatory. They don't give narcotics to these children. It's NSAIDs. And as I said, it's either cold or hot. I mean, I hate hot. Don't give me hot. My pain is worse. Give me a bath of ice and I'm a happy person. And then always, any child in pain, do that distraction. Put on music, put on TV, give them an iPad, give them something. And they're not going to really focus on the pain. Good job, guys. Highest priority for a child with sickle cell. What do? What is it? I don't really like the way that question is written the most, but if you have a child with sickle cell or any immunosuppressive disease, if this child has a fever of 100.5, you need to get them to doctor to call them immediately. And the reason is remember, fever burns up liquids and it will make those vessels even smaller. And these children do get antibiotics. 100.5, they're going to be getting the fever. Now, pain is telling you they're having that sickle cell crisis for sure, but the fever is the one that's going to needs to call the physician like right now. That's what's going on. An infant's sweat tastes salty. What is that? What are you going to do? That's your sweat test, right? This is all CF. The other thing that you're going to see in newborns is no stool. You'll be checking for CF because it's one of those things that it could be. That and thyroid disease or Hirschsprung's disease, right? A child with bronchiolitis is admitted. What are you going to do for that child, huh? So bronchiolitis is that RSV. It's another word for it. And we're going to keep that child isolated so that they're not going to give their germs to another child. Yes, we'll always wash our hands, any child. A multi. How do you diagnose hip dysplasia in an infant? Remember, we put these children in that Pavlik harness, and it's 23 hours a day. We only take it off so that they can take a bath. Now, positive ortolani, those buttocks, one's going to be higher because, you know, when you have that hip joint, it's up here, our leg's going to be shorter, and then the buttocks going to be different. The foot pointing inwards, outwards, that's a fractured hip on an adult. That's when you see that foot going the wrong way. That's an adult fractured. Why do sickle cell patients have enuresis? Well, what is enuresis? Urinating at night, right? Why do you think that would happen? What do we tell sickle cell patients to do? Keep hydrated. We want those vessels big to prevent the clogs up of cells, right? So it's because they're overhydrated and they urinate in the night. What causes acute glomerular nephritis? Or rheumatic fever, right? And that again is a strep infection. And glomerulonephritis is oliguria, right? And it would be that red bloody urine or foamy urine, high blood pressure. And until we get that strep infection controlled, we're going to be watching the diet with fluid and salt intake and doing INO daily weights. We always worry about that. Kidneys, think always those things. A multi. What may be a problem seen after surgery for a tetralogy of Fallot? Congenital heart, post-op. What do you worry about? We had a question earlier about it. This is another one that's just reiterating the understanding of it. Again, this is a child, we're worried about congestive heart failure. So if you see them, they're not eating well. They just tire out. You see them breathing hard. It's congestive heart failure. Any congenital heart defect can cause that. Very good. A child with pertussis is receiving azithromycin IV. What priority should you include in the child's care plan? What are you looking for? Azithromycin, it's an antibiotic. we're going to be looking antibiotic side effects, vomiting and diarrhea always, right? Now, will we be monitoring them for some sort of anaphylactic? Yes, I would put it in there. Absolutely. I would change that answer to include both of them. But remember, any antibiotic given, you always are concerned with that abdominal pain, vomiting, diarrhea, because it could happen with any of them. And then, of course, always watch for anaphylactic reactions to antibiotics. An infant is scheduled for a cleft lip repair, which information is priority to convey to the surgeon before surgery. Now, this is you knowing normals in, children. Which one is not normal? This is your red blood count of 2.3. It's not enough. It's too low. This child needs some sort of intervention before, because what is our concern in any surgery? Bleeding, right? So we will be checking that. White cell is normal. Urine gravity, specific gravity is fine. And weight gain. Weight gain is good. When administering indomethacin to an infant who has a patent ductus arteriosus, what outcome do you anticipate? PDA, that fetal circulation, we're closing it medically with the indomethacin. What did I tell you? And this is, you're going to see that murmur start to go away. And the other thing is that blood pressure is what we call wide pulse pressure. You could have 60/18 instead of 60/40, which is normal. You'll see that bottom diastolic number come back to normal. That's the other thing that you see with it. But it's the murmur that you listen to. A parent of a boy with Duchenne muscular dystrophy, okay, this is a repeat question, sorry. Wants more children, what information should be provided? There's different answers. But Duchenne muscular dystrophy, we know who it affects, and we know that this is all about mom's recessive genes. So yes, it affects the males in the family, and it is that X link. So they need some genetic testing if they're going to even consider a multi. Which behavior by a child should alert the nurse to request a follow-up for possible autistic spectrum disorder? Again, that's that odd behaviors. Again, you're talking to them, they're not listening, they're sitting by themselves. They don't like lights, they don't like people, they don't like noise. All of those things are part of it, but those would be two of the things that you would, again, evaluate further for autism. Kawasaki disease management includes aspirin therapy. What's the benefit? Different way of asking a question, seeing if you're understanding. And it's all about that itis, right? Vascular itis is that inflammation. It decreases it. Good. A breastfeeding infant has a low T4 and a high TSH. The best explanation for this is what? And actually, this was a question that one of the students said, this was on a HESI, and I have no clue what they're talking about. And if one is low, the other is high, and that's just normal. That's just part of the way that the thyroid gland works. So the T level is up, the T is low, it's high. If this is high, this is low, and it's just conversely what it is with that. And last question. After giving indomethacin to an infant and closing the PDA, What assessment would you see? I think you got that one down now. And again, yes, it's that murmur. Good job, guys. So Ashley, 3. Good job, Ashley. Number 2, we got a trail. Thanks, Latrell. Number 1, Florence Nightingale. Thanks, Kendra. Jess and Sam. Good job, guys. All right, let me get you out of here. Guys, thank you for being patient with me. Remember, on Sunday, I am doing that review at 2 p.m. And yes, it will